We continue our series for the children. It's important to know when to introduce certain foods during the first year of life for children. And joining us today with helpful tips is Dr. Michael Ramsey. Good to see you, Dr. Ramsey.
Good to see you. Thank you for having me.
Now, what should parents know, rule of thumb, about introducing children to certain foods during their first year of life?
Right. The first thing to remember is that it's very important during those first 4 to 6 months to really just use either breast milk or formula. As we look at studies on how you feed children, we see that kids who have solid foods introduced too early do have a higher risk of obesity as they get older. And so the safest and best thing to do is to exclusively breastfeed or exclusively formula feed for the first 4 to 6 months. Starting around 4 to 6 months is when most people really get tired of just using the bottle or just breastfeeding, and so they do start wanting to introduce other baby foods and move their baby along developmentally. And so the first thing that we recommend is starting with a cereal, usually rice cereal, because that's the least likely to cause an allergic reaction. Most kids tolerate that well. And then once a child is taking that well off a spoon, then starting to move to other baby foods. Stage 1 foods are always single ingredient and very small sizes, so that's what we recommend starting with. And I usually tell my patients to try to do a few vegetables first, just because they don't taste quite as good as the fruits. And so I do have some kids who get those fruits first, and then they think everything's supposed to be sweet, so it's a little bit harder to introduce them later on.
Well, that was my next question. What happens if they just don't want to eat the food you're giving them?
Right. Well, during the first 6 months, I say don't get stressed out, because they don't really need it anyway. And so starting after 6 months, the kids are going to add it because they get more hungry. And so it's usually a very temporary thing if they do have some food refusals.
And what about regular, like, older adult food?
Older adult
is that okay to give a young infant?
It is at certain points. You know, between 6 months and 12 months is just a long transition of feeding practices. And so as they're taking baby foods, if you're having something soft at the table and you want them to try it, you can. What I usually recommend is for people to avoid eggs until about 9 months, milk and honey until a year. Milk is associated with anemia, and then honey can be associated with botulism, and then trying to stay away from peanut butter till they're about 2.
That was my next question. You've already answered part of it. What are some absolute no-nos as far as foods besides the ones you've mentioned?
Those are the big things. And then you want to make sure, as far as food safety, that the bite size is appropriate. Make sure if you're using hot dogs or other meats that you're cutting them into small pieces. Never cut a hot dog just in a medallion and give that to a baby, because that is a choking hazard.
Okay, what about if you've noticed that your child may be having an allergic reaction to a food? What would the signs be?
Right. Most kids with food intolerances are going to have more GI discomfort, diarrhea, and that type of thing. An actual food allergy is not super common, but you can have them break out in a rash or develop itching or fussiness. A true anaphylactic reaction like difficulty breathing will be very uncommon in an infant.
Okay, so if they do notice some strange behaviors after a child eating food, is it important to call their pediatrician?
Right, I would call your pediatrician, discuss it with them. I would also, it's a good idea anyway to keep some Benadryl on hand, but I wouldn't give it until you actually talk to the doctor to make sure that that's okay.
Okay, thanks for coming by.
Thank you for having me.
And if you have any questions for your children, you can email us at morning@WTVY.com. Also, if you'd like to watch this interview or any past interviews, you can log on to our web channel at WTVY.com and click on For the Children.
Stick around. I've got one final look at your